Hello. Today I'd like to take you through the essential oil protocol for neurofeedback. Now, many of you have been asking, there's so many different oils, what do I use and why do we use them during neurofeedback? So this is the perfect video to help answer those questions. Now, the first thing that we do, we always start off with 2 oils before every training session. Now, it's very important that you don't use any essential oils before you do a map. It will alter the effect of the map and make the patient look better than they actually are. So, before the training session on every patient, we are doing 2 essential oils to enhance the quality of the training. Now, in the past, we used to use all sorts of relaxation techniques and oxygen therapy to help get them prepared to train. Now, with the use of essential oils, we can get them right into that zone within 30 seconds. It's absolutely amazing. So the first oil we use is one called Balance. Now, Balance is the one that's a grounding blend. As we know from the videos using Balance in the clinical trials, that when they look at a dark field microscopy after they take blood from the patient and all the hemoglobin are stuck together, they put 1 drop of Balance on the bottom of the feet and 30 seconds later can draw blood from the finger again and it's all open. Every red blood cell is wide open, holding oxygen, carrying nutrients to the body. So this is a very good one to get them to calm down and relax and get into the zone and be ready to training. So that's the first one we do. The second one we do is called Peppermint. Now, Peppermint has an amazing ability to bring a lot more oxygen to the brain in just 15 seconds. In fact, 20% more oxygen to the brain. And so this is very effective before our neurofeedback training and getting them actually training and successful in neuroplasticity. And so those are 2 great oils that we do on every patient. Now, outside of that, we've come up with 4 different categories which most of our patients fall into. And with that, we would recommend 1 or 2 additional oils on top of the one that everybody does for training. So let's talk about the 4 different categories. We have people that need to be calmed down and rest better. We have people that need to be woken up because they're too tired. Okay. We also have people that may have had some brain damage, a traumatic brain injury, maybe a birth defect, maybe autism, maybe they have certain issues that we really need to help overall brain health. And then the last category is going to be for focus and concentration. So with the first category, rest and relaxation, we might add 1 or both of these oils right before their session as well. Outside of the days of the session, for these 4 specific conditions, we want them to be using these oils, whatever oil we decide, daily, twice a day. And that's going to enhance their overall big picture of the training that they're getting and the results that they're going to get. So we try maybe Lavender first or Serenity. Both are very calming and relaxing. Now remember, everybody's chemistry is a little bit different, so I can't say that there's going to be one oil that works for everybody. Lavender seems to work for about 80% of the people. The next best choice is Serenity. And if either of those still aren't working and helping you calm down, we have a backup, and that one's called Pedigree. Pedigree is very similar to lavender in its properties, but doesn't smell like lavender at all. And so therefore, if some people just really don't care for the smell of lavender, this would be a great alternative choice. Outside of the ones that need more resting and being able to calm down, the next one is we need people to have more joy and uplift them and get them happy again. And so our number 1 oil for that is going to be Elevation. Okay, Elevation is that joyful blend. Helps block negativity from people around them, helps them see only the good in people. Outside of Elevation, we would use Wild Orange. Wild Orange is a great one that it's been used in multiple clinical studies in hospitals for keeping everybody happy and relaxed and peaceful. Okay, keeps them joyful. Now, if either of those 2 aren't getting the results you're looking for, we do have a backup oil, and that one's going to be called Citrus Bliss. Citrus Bliss is a combination of multiple citrus oils, and it is a wonderful, joyful blend. It's an invigorating blend, so that's going to wake you up and help them experience that. Now, we move into the traumatic brain injuries, the people that need overall brain health. Maybe they're having memory loss. Maybe they're dealing with being able to have cognitive function and want that improved through their neurofeedback. We would absolutely add sandalwood or frankincense. Either or both of these, depending on the willingness of the patient. If it were me, I would probably do both in each category. And again, sometimes people might not respond as quickly to the oils that you're thinking that they should. And so we have a backup for frankincense, and that's called spikenard. Spikenard has very similar properties to frankincense. So if one's not working as well as the other, we try the other. Okay? And so outside of overall brain health, we want to move into the category of focus and concentration. This seems to be a very common category for many of you during neurofeedback. ADD patients and kids that just can't hold a concentration for any length of time. So the number one oil for that is going to be In Tune. Again, that is the blend that's called the Focus Blend. It pulls a lot of things together. Now, many of those patients have a hard time falling asleep at night, and they're just bouncing off the walls. They found with vetiver, it can help chill them out just like that. Okay, amazing product there in the vetiver. Now there is a little bit of vetiver in the In Tune, but something about the straight concentration of that can have a much more profound effect on some people. And then on the backup for that category, we're going to use something called Cedar Wood. Cedar Wood is very good for overall brain health, anxiety, and focus, okay, and concentration. Hope that helps for you. We also came up with a recommendation pad to make that very simple for you to make the oil recommendations out of these choices that we have for your patients when you're first talking about their care plan. And overall, these are going to help enhance the end result of their neurofeedback training. So it would just make sense if they understand that there's no reason they should be moving forward without the assistance of essential oils to get the best they possibly can get for the care that you're giving them. Hope that helps. Y'all have a great day.